Let's start today with something special. We're going to begin a one-year-long series of stories focusing on the 50th anniversary of the Health District, sort of a trip down memory lane on Shadow Lane. For longtime residents, a sense of nostalgia, and for those more recent arrivals, some answers to how things we take for granted here in Las Vegas and Clark County actually came to be. Today, though, we're simply going to introduce you to the three men who've led so far, and how the management style of each has left his own unique mark on the agency.
I don't have an appetite for bureaucracy in my own mind, and I would say that my management style over the years, I didn't have a staff meeting the last half dozen years. I did all my management walking around. But then you see how the interaction goes between the Indians and the public, and you listen to their version of what's happening, and if you don't burn the supervisor by doing unwise things, it can be, very valuable. You know what's going on.
In 1998, after more than 35 years as the original Chief Health Officer of the district, which also included 25 years as county coroner, Dr. Ravenholt retired, but not before recommending Dr. Donald Kwolek take over the reins.
When I got ready to retire, I brought Don Kwolek down. He had been the state health officer as an assistant, and he took over. But we lived in Clark County. There wasn't much deference to the state of Nevada, except that the legislature meets every 2 years.
Still, no matter what the prevailing attitude toward the state was at the time, in light of the long and high-profile career of his predecessor, you would think for Dr. Kwolek, stepping into the role of Chief Health Officer would be a daunting challenge.
It was and it wasn't. I mean, he had, or I had big shoes to fill for sure. But I was here for about a year or so before that. I was in Nevada for 7 years as state health officer before that. So I knew Nevada, I knew Clark County a little bit. So it was a lot easier than just coming in cold, so to speak. I think one of the qualities of a good executive is having the sense to really appoint and hire people that can get the job done, keep you informed, make wise decisions, and discuss things with you on a basis that has you really reach a good decision. And I think over the course of my career, and especially the people that I worked with here, the people that jumped in and took responsibility really had a wealth of knowledge and used that knowledge to the betterment of the public in southern Nevada.
And although Dr. Kwolek faced the health and safety challenges as Clark County and the world crossed into a new millennium, he never lost sight of the true focus of public health.
When people ask me what did I do when I said I was in preventive medicine, public health, I said my patient, rather than an individual patient that I'd be dealing with, is the community. That's my patient. So anything that would impact the entire community is what a public health physician and the director of a large health department would be involved in, along with his staff or her staff, on a continuing day-to-day basis. Well, I'm kind of proud of several things that happened during my administration. Fluoridation of the water supplies, starting the ball rolling as far as tobacco control, school-based health centers and clinics. What else? The trauma system got underway, bringing the budget up to over $60 million from $20 million, and expanding a lot of different programs. When I first started, after Ravenholt, the board, they were all interested in public health rather than purely politics. And things that happened because the public really needed it, and the health system, the public health system, and not health care system, which people always get confused about. Probably 99% of the expenditures right now in health care is on sickness care, not on prevention of disease, which is so important, and that's what public health is all about.
Dr. Kwolek retired in 2007, which brings us to our current Chief Health Officer, Dr. Lawrence Sands. A point of interest, Dr. Sands came to us from Maricopa County, Arizona. And 50 years ago, it was the well-respected Chief Health Officer of Maricopa County, Dr. Farnsworth, who enticed Dr. Ravenholt to lead the new Clark County Health District.
My approach to public health has always been that public health is all about partnerships, and that public health is what communities do to assure conditions exist so that people who live in that community can be safe and healthy. And and that's what I like to see more my approach, and hopefully my legacy of building more of those relationships. Starting in this position, coming to the health district several years ago, the district already has a very long history of building very good relationships in the community and very good, strong partnerships. And and through my leadership, what I have strived to do is to build on that. I think the basic core of public health has always remained the same. It's all about working in partnership with the community to assure the conditions in the community are able to help promote and protect the health of people who live there. Essentially, public health basically reflects what people in the community want health to look like. I don't think that's changed. How we do it and some of the issues that we deal with have changed over time, but the basic process still remains pretty much the same.
But if the goals of public health remain universally the same, technology and information sharing have certainly moved light years ahead of a half-century ago. Not just among public health professionals, but in terms of the public's expectations as well.
As technology has developed and we've make increased use of technology, information comes in much faster. And there's a greater expectation that people respond much faster to that information. So you have to adapt to that. You have to build an infrastructure to be able to both manage the information as it comes in and be able to manage your ability to and your capacity to respond effectively when you receive it.
Dr. Sands has no crystal ball. No Chief Health Officer does. Where Dr. Ravenholt was confronted with the challenges of AIDS and the MGM fire, and Dr. Kwolek had to deal with the local impact of national disasters like 9/11 and Hurricane Katrina, Dr. Sands has no way to predict what crisis he may face on his watch. In the meantime, he has a vision for the health district.
So where I see us going as an agency is that will always be central to what we do is focus on the community, and the people that we serve, and ensuring that they are receiving the best services to address the health issues that affect our community. And the two ways that we are looking, or I'm looking to move the agency is, one, we've already have started in on and put major investments over the last few years in improving our capacity to be able to collect and manage and process data so that we can be much more of a data-driven organization. And then in order to achieve the support that with our focus on customer service and the focus on the community is to also adapt more of a quality improvement culture in the district with an infrastructure that will support that.
3 men, 3 leaders, each committed to protecting Southern Nevada, its residents and visitors, and each adapting to its changing needs.
Ibsen's book on the enemy of the people, one can readily discover that the community does not wish to expose the problem and deal with it, but wants to wait for it to pass. And that calls for some effectiveness and diplomacy and so forth to get cooperation on some of those measures that have to be taken.
I think we did some innovative kinds of things that had to be done, that people said couldn't be done, and we got it done.
It's educating the public, our electeds, understanding the value of what public health does in the same way that they understand the value of what other public safety agencies do.